obliquely placed, and the gastric juice can easily flow to the duodenum. Okay, that's why duodenal ulcer, this type of individual are more prone to duodenal ulcer, while hyposthenic type, because of its more vertical in position, the gastric juice for a while or for some time will be collected within the stomach, making that individual more prone to gastric ulcer. Okay, once again I repeat, it is not that all the hypersthenic individual with hypersthenic stomach has to suffer from duodenal ulcer, and with hypersthenic has to suffer from gastric ulcer. But like study wise or prevalence wise, hyposthenic individual will be prone to gastric ulcer and hypersthenic will be prone to duodenal ulcer. So this is about the variation in position, and depending on the placement of long limb of the stomach can be divided into hypersthenic, sthenic, and hyposthenic type. Then going for the size and capacity of the stomach measures about 25 centimeter in length. That is about 10 inches in length. Okay, and capacity wise, the capacity of stomach vary individually. Okay, so at the time of birth, it has a capacity of about 30 ml. At the time of puberty, by the time of puberty, it reaches up to 1 liter, and in adult individual, the capacity may vary from about 1.5 liter to 2 liter. Okay, this is about the size and capacity. The capacity of stomach is variable depending on the age, and even it is variable depending on the individual. Then presenting part of the stomach. So what are different parts of the stomach is, stomach consists of two ends. Okay, the two end, the upper end of stomach is known as cardiac end, where this esophagus, abdominal part of esophagus comes and open into the cardiac end of stomach. Lower end of stomach is known as pyloric end, from where duodenum starts. Okay, so the two ends of stomach are cardiac end. The upper one is the cardiac end, and lower one is the pyloric end. Then it consists of two borders. So we can see here one of the border is smaller compared to the other border. Okay, so the smaller border which is present on the right side of the body is known as lesser curvature, while opposite just the large longer border on the left side of the body, that lies on the left side of the body, is known as greater curvature. Remember, lesser curvatures and greater curvature is about 5 times more in length than the lesser curvature. Okay, so lesser curvature can be considered as right border and greater curvature left border of the stomach. Then it consists of two surfaces, which are anterior superior surface and posterior inferior surface. Okay, the two surfaces of stomach are anterior posterior and posterior inferior. So let's go on detail about this individual part of the stomach. Firstly, the end of stomach, two ends of stomach are cardiac end and pyloric end. Okay, so these two ends of stomach are more fixed at its end, but in between, all the body and the remaining part of stomach is mobile rather than its end. The ends are more fixed than its body. Cardiac end, where abdominal part of esophagus enters the stomach. Okay, and vertebral level for that is that will be the end of the esophagus at the opposite the body of 11 thoracic vertebra. Okay, or just behind the left 7 costal cartilage. Okay, this is the bony level of cardiac end, or we can say cardiac end of stomach or lower end of esophagus. Same point, esophagus ends and stomach begins there. So cardiac end, the vertebral level is, it lies at the 11 thoracic vertebra or behind the left 7 costal cartilage. Then this cardiac end actually has no anatomical sphincter, but physiologically it acts as a sphincter. So it is a physiological sphincter. Like we have in last lecture we have studied about the lower esophageal sphincter, no anatomical sphincter, but physiological or functionally it acts as a sphincter because of the thickening of smooth muscle there, circular muscle there, preventing regurgitation of gastric fluid into the esophagus. The next end is the pyloric end. Okay, pyloric end lies in the transpyloric plane, which measures at the level of first lumbar vertebra. So the vertical level of pyloric end in case of cadaveric stomach and in supine position is L1 vertebra. Okay, and this pyloric end, which is formed by pyloric canal of about 2.5 centimeter long. Okay, pyloric end is guarded by pyloric sphincter, which is both anatomical and physiological entity. Anatomical also, it is formed by, we can when our we go for practical, you can feel the pyloric end of the stomach and cardiac end of the stomach. In cardiac end, we cannot feel such as any sphincter, but in pyloric end, we can feel a thickening of circular muscle, a thick sphincter we can feel there. Okay, so it has a total anatomical sphincter, preventing or regulating the chyme flowing out from the stomach. So this is about the two ends of the stomach. Then two borders of the stomach are lesser curvature and greater curvature. Lesser curvature, which is also can be considered as right border of the stomach, which extend from the right end of the cardiac orifice to pyloric end. Okay, and this lesser curvature is connected with, or it is suspended from the liver with the help of lesser omentum, that is the fold of peritoneum. While greater curvature, which can be considered as the left border of the stomach, it extends from the left end of the cardiac orifice. Okay, it passes through the highest point of the stomach, that is fundus of the stomach, and finally ends into the pyloric end. Then three structures get attached within this greater curvature, which are the ligaments. Gastrophrenic ligament. So name itself suggests gastrophrenic means the fold of peritoneum extends from the stomach to the diaphragm, phren. Okay, the left cross of diaphragm. Then gastrosplenic ligament from stomach to the spleen, and greater omentum, that is the fold of peritoneum itself, greater omentum. So this is about the two borders of the stomach. Are you people getting my points? Are you there? Are
Yes,
you there?
ma'am.
Okay. So I hope all of you are cleared. Getting my points?
Yes, ma'am.
Okay. So here, this diagram shows the, what is this? Where I'm pointing, this is which curvature?
Lesser curvature.
Lesser curvature. Lesser curvature, okay. And lesser curvature extend from the here cardiac orifice to the pyloric orifice, and greater curvature extend from the cardiac orifice to along with this fundus of the stomach, this highest point of the stomach. This is the fundus of the stomach, and up to the pyloric orifice. So this is greater curvature, which is 5 times longer than the lesser curvature. Okay, and lesser curvature give attachment to lesser omentum, which is the fold of peritoneum reflecting from stomach to the liver. Lesser omentum, and greater omentum, which is the now the fold of peritoneum, which extend down and again ascend up to get attached within the transverse colon. This reflection of peritoneum will be more clear in your peritoneum class regarding this peritoneum. Okay, for now, remember, lesser omentum is attached within the lesser curvature and greater omentum is attached within the greater curvature of stomach. Then the surfaces of stomach. Actually, the stomach is not exactly vertically placed. Okay, so we cannot directly say the anterior and posterior surface. So the one of the surface is directed more of anterior superior, and another surface is directed reciprocally posterior inferior. Okay, and actually the position of this surface of stomach depends on the amount of food or amount of food that we ingest is present. Okay, so depending on the distensibility of the stomach, if more of the amount if the stomach is empty, it is more of directed superior inferiorly, and if it is full, then it starts to direct anterior posteriorly. Okay, so the stomach surfaces of stomach are anterior superior, it is directed slightly anteriorly and superiorly, and slightly posteriorly and inferiorly. So the surfaces are anterior superior and posterior inferior. Here, the surface shown here is the anterior superior surface. Behind that is the posterior inferior surface. So this is about the surface of stomach, and then division of stomach. Now, after different parts of the stomach, we'll go for the division of stomach. What is this end here? What is this end of stomach?
Cardiac.
Speak out.
Cardiac.
This is cardiac orifice. Okay, or cardiac end, and this is pyloric orifice or pyloric end. Okay. So the stomach is divided into fundus, body, and pylorus. Okay, fundus is the highest part of the stomach, which we can demarcate it. Actually, we can draw an imaginary line passing horizontally through the stomach from the level of cardiac orifice. So simply draw an imaginary line from cardiac orifice to the left side. Okay, so this line or the part of stomach that lies above this line is known as fundus. Then this which curvature is this? Miss, I'm pointing. This one is which curvature? Leisure curvature. And this one is greater curvature. Okay. So within this leisure curvature, there is at the lower part of the leisure curvature, there is a deep indentation, which is known as incisura angularis. Okay, remember this point within the leisure curvature, the deepest point, or there is a deep knots present within the lower part of leisure curvature. So this knot is known as incisura angularis. So when we draw an imaginary line towards the greater curvature from this incisura angularis, and the part between this first line from cardiac orifice to greater curvature and second line from incisura angularis to greater curvature. So part of stomach between these two lines will be the body. Part of stomach above the first line will be the fundus. So this is fundus of the stomach, this is body of the stomach, and the remaining part is the pylorus of the stomach. Okay, and this pylorus of the stomach is further divided into a dilated funnel shaped structure known as pyloric antrum. Okay, this is dilated and funnel shape known as pyloric antrum, and the narrow canal having pyloric canal is known as pylorus, and its or the end is known as pyloric orifice. Here, this is pyloric orifice. This whole length about 2.5 centimeter long is the pyloric canal having pylorus having pyloric canal, and this is dilated part of the pylorus known as pyloric antrum. So simply the three parts of stomach are fundus, body, and pylorus. The pylorus is further divided into pyloric antrum and pyloric canal. Are you clear? This is about the division of stomach, which is shown in this tabulated form. Fundus, which is dome shape, which projects upward and to the left of the cardiac nose, and this fundus of the stomach is the part which is usually filled with gas. Okay, it is almost always full with gas. That's why when we go for the chest x-ray, okay, or plain x-ray, below the left dome of diaphragm, there we can see a small radiolucent area. That is actually the gas filled in fundus of the stomach. Okay, then the next part is body, that extends from the level of cardiac orifice to the level of incisura angularis, which is a notch in the lower part of the leisure curvature. That is the body. Then pyloric antrum is funnel shape. This pyloric antrum and pylorus in both of them is known as pyloric part of the stomach. Okay, which is further divided into pyloric antrum, which is funnel shape extending from incisura angularis to pyloric canal or pylorus. Then pylorus is tubular part of the stomach with a cavity which is known as pyloric canal, and it consists of thick muscle coat which become the pyloric sphincter. Okay, so these are the, simply you remember three parts of stomach known as fundus, body, and pyloric part. In some, according to some author, you may, if you go through your textbook, according to some author, fundus and body combination, both of this part in combination is known as cardiac part of the stomach and pyloric part of the stomach. But for now, just remember fundus, body, and pylorus. Okay, are you clear about the parts of stomach? It consists of fundus, which is more clear from this diagram. It consists of fundus above the line from cardiac orifice. This is fundus, and between the line from cardiac orifice to incisura angularis, this is body, and the remaining part of the stomach is pylorus, which is further divided into pyloric antrum and pyloric canal. I hope you are clear now. Then we'll go for the relation of the stomach. Okay, so when we study about the relation, we should know about peritoneal relation and visceral relation. So as we are talking now, we have started studying about the viscera present within the abdominal cavity. So the viscera present within the abdominal cavity, every viscera when we study, we should be clear about its peritoneal relation also, beside the visceral relation. So let's start first with the peritoneal relation here. So this diagram showing clearly the stomach, which actually is intraperitoneal structure. Stomach is both anterior superior and posterior inferior surface of stomach is covered by peritoneum. Okay, so this anterior superior surface and posterior inferior surface, two layers of peritoneum cover the two surfaces of stomach, and it gets reflected from leisure curvature towards the liver, forming the leisure omentum. Okay, but remember this leisure curvature itself, because the two surfaces covered by two layers of peritoneum when reflect directly to the liver, this exactly the leisure curvature itself is not covered by peritoneum, because from there the peritoneum is reflected. That's why we can consider leisure curvature of stomach as one of the bare area of stomach. Bare area means which is devoid of peritoneum or not covered by peritoneum. Okay. And then from greater curvature, the peritoneum, two layers of peritoneum reflect downward in the form of greater omentum. And here also, like the lesser curvature is bare area of stomach, this greater curvature is also the bare area of stomach. Now get the points. When a structure is covered by two layers of peritoneum, and the two layer of peritoneum when reflect from the lesser curvature, this lesser curvature will be devoid of peritoneum, and the greater curvature also it is reflecting the, making the greater curvature devoid of peritoneum, forming lesser greater curvature as the bare area of stomach. Okay, so this is about the peritoneal relation of the stomach. Then visceral relation of the stomach. We'll go for the visceral relation. So firstly, let's start with the anterior superior surface. So this anterior superior surface of stomach is related on its upper and left part with left costal margin. See, stomach is present here. This region is the area of stomach. Okay, so its upper and left part it is related with left costal margin as well as diaphragm. Okay, so this diaphragm is separating the stomach from the left pleura. So left costal margin and diaphragm, left dome of diaphragm is related with the left upper part of anterior superior surface of stomach. And again, the right upper part is related with left lobe of liver. Okay, and the lower part of the stomach is related with transverse colon. So this transverse colon, this liver and costal margin is forming a triangular area within the anterior surface of stomach. So this small triangular area of stomach is in direct relation with the anterior abdominal wall. Okay, so small triangular area of stomach which is directly related with anterior abdominal wall is known as gastric triangle, which is important for surgeons to perform the gastrostomy surgery. Okay, when we have to bypass some disease, intestinal, small intestine, or let's say any part of the intestine, then this gastrostomy is done with approaching via this gastric triangle. Are you clear about gastric triangle? Are you listening or not?
Ma'am, could you please
Yes,
repeat
ma'am.
the
About
triangle?
gastric triangle?
Yes, ma'am.
Okay. So here, see here, this is stomach. Whole part of the stomach is seen here. Okay. The upper and left part of stomach is related with left costal margin, isn't it? Then upper and right part of stomach is related with left lobe of liver. This is liver, left lobe of liver. And the lower part of stomach, the transverse colon passes through somewhat like this. Okay, lower part of stomach is related with transverse colon. Now, the triangular area formed on the or this, let's say gastric triangle is bounded on its right side by inferior border of liver, on its left side by left costal margin, and on its inferior part by transverse colon. So this triangular area among these three structures is known as gastric triangle, and this gastric triangle is directly related with anterior abdominal wall. So surgeon can perform or approach to stomach directly from this triangular area, directly from the anterior abdominal wall. Okay, so this area is known as gastric triangle and required for this surgeon to perform its surgery directly approaching the stomach. Okay, mostly, for example, gastrostomy is done from this triangle. Now clear?
Yes, ma'am.
Okay, so I will proceed. Then posterior relation of stomach. So the structure present or the viscera related behind the stomach forms a bed for the stomach. Okay, like let's suppose stomach is sleeping within the bed formed by these different viscera. So what are the structure related behind the stomach or the structure forming the stomach bed? That is very important for you from your theoretical point of view as well. Clinically, it is obviously important. Okay, so to enumerate the structure related on its posterior surface of stomach, from above downward, let's get oriented from above downward. Let's start. Okay, in an order, if you go in an order, it will be easier for you to remember. Firstly, on its uppermost is related with left cross of diaphragm, or let's say diaphragm. Okay, it is related with diaphragm. Posteriorly, stomach is related with diaphragm. The next is here, this is spleen. Actually, spleen is related with stomach in case of distended stomach. In case of empty stomach, it might not be related directly with spleen, or only small portion might be related. Okay. The next is the left suprarenal gland. Then upper pole of left kidney. This is splenic artery, then body of pancreas. Okay, body of pancreas, and then transverse mesocolon. These are the structure forming the stomach bed. Or if you are asked about posterior relation of stomach or stomach bed, same thing. Okay, remember the viscera which are related with posterior surface of stomach forms the stomach bed, as they are forming kind of bed for the stomach, so it is considered as stomach bed. Okay, again to enumerate the structure are from above downward, it is diaphragm, left part of diaphragm, then left suprarenal gland, upper pole of left kidney, splenic artery, pancreas, body of pancreas, and then transverse mesocolon. And also spleen can be considered. Okay, spleen is also related or forming the structure forming the stomach bed. So this is about the posterior relation of stomach. Then interior of stomach. When we cut off the stomach and view the interior of the stomach, as we have already mentioned, it is a muscular bag which is highly distensible and most dilated part of as a whole GI system. Okay, so stomach has the empty stomach has numbers of irregular folds of mucosa known as rugae. Okay, it consists of numbers of irregular fold of mucosa known as rugae, and these rugae are actually temporary folds. When the stomach is fully dilated, all of these rugae disappear. So these folds of mucosa or this rugae within the stomach are just temporary. In case of empty stomach, it appears, and in case of distended stomach, it disappears. So we can say temporary mucosal fold are known as rugae here. Okay, and we can make certain pattern of the rugae here. See, towards the greater curvature, these mucosal folds are irregularly arranged. Okay, towards the greater curvature, these mucosal folds are irregularly arranged, while towards the lesser curvature, these mucosal folds are longitudinally arranged. Can you see? Can you relate this thing in this diagram? Are you getting my point? These mucosal folds towards the lesser curvature are longitudinally arranged, while mucosal folds towards the greater curvature are irregularly arranged. Okay, so this longitudinal mucosal folds towards the lesser curvature forms a canal between two longitudinal mucosal fold, which is known as gastric canal. Okay, are you people getting my point?
Yes, ma'am.
So this longitudinal mucosal folds towards the lesser curvatures forms the gastric canal in between. And this gastric canal, because of presence of this gastric canal towards the lesser curvature, suppose when we drink hard beverages, okay, or caustic fluids, when person drinks caustic fluid, it directly moves towards the lesser curvature along with this gastric canal rather than towards the greater curvature. Okay, so because of this, lesser curvature is more prone to gastric ulcer, because these beverages that we drink directly reaches towards the lesser curvature and causing toxic insult there. That's why lesser curvature is more prone for gastric ulcer. Okay, so here this is the cardiac orifice which lacks proper anatomical sphincter, and here this is the pyloric end guarded by pyloric sphincter. Can you see this pyloric sphincter, which is formed by thickening of the circular muscles of stomach itself. Pyloric sphincter, here pyloric end guarded by pyloric sphincter, and cardiac end having this lower esophageal sphincter. So this is about the interior of the stomach. Then we'll go for the blood supply of stomach. Any point do I need to repeat till now? Are you clear till now? Are people listening or not?
Yes, ma'am.
Yes, ma'am.
So do any
Yes,
topic I need
ma'am.
to repeat? Shall I proceed? Okay, I will proceed then. So arterial supply of stomach. For this, have you ever heard about gut, mid gut, and hind gut? When you study about the general embryology, during the embryonic fold, and then for this yolk sac part is some part is pinched out of the embryo proper, and some of it is lying within the embryo proper, forming foregut, midgut, hindgut. If you remember about the general embryology, isn't it? So the stomach actually is the derivative, or it is one of the part or derivative of foregut, and the artery for foregut is celiac trunk. Artery for midgut is superior mesenteric artery, and artery for hindgut is inferior mesenteric artery. Okay, remember this thing. So as stomach is the part of foregut, obviously it will be supplied by branches of celiac trunk, that is artery of foregut. So the right upper part of the stomach, okay, right and upper part of the stomach is supplied by this left gastric artery, which is the direct branch of celiac trunk. Celiac trunk consists of three branches, which is common hepatic artery, left gastric artery, and splenic artery. So talking about the arterial supply of stomach, this right and upper part of stomach is supplied by left gastric artery, branch of celiac trunk, while right lower part of the stomach along the lower part of leisure curvature is supplied by right gastric artery. See, it is easy for you to remember. The right part of the right upper part of the stomach is supplied by left gastric artery, because when we compare this leisure curvature, this lies towards the right side of the body and this lies towards the left side of the body. Are you getting my point? This part of leisure curvature lies towards the left side of the body, and this part of leisure curvature lies towards the right side of the body. Okay, so this part of the leisure curvature, upper part of the leisure curvature is supplied by left gastric artery, and lower part of leisure curvature is supplied by right gastric artery, which is the branch of proper hepatic artery. Similarly, the greater curvature, upper left part of greater curvature is supplied by left gastroepiploic artery, which is the branch of splenic artery, and the lower part of the greater curvatures on the right side, or right lower part of the greater curvature is supplied by right gastroepiploic artery, which is the branch of gastroduodenal artery. Okay. This gastroduodenal artery, properhepatic artery, both of them are branches of common hepatic artery, which in turn is the branch of celiac artery. Okay, that's why celiac artery is the one which is indirectly supplying the stomach as a whole. Once again, I will repeat, the upper part of the leisure curvature is supplied by left gastric artery, lower part of leisure curvature, or the part of stomach along the lower part of leisure curvature, is supplied by right gastric artery. Then the upper and left part of greater curvature is supplied by left gastroepiploic artery. Lower and right part of greater curvature is supplied by right gastroepiploic artery, and the remaining part is fundus of the stomach, which is supplied by short gastric arteries, which also in turn is the branch of splenic artery. Okay, so you have to remember 5 arteries which supply the stomach. So this arterial supply of stomach, venous drainage of stomach, and lymphatic drainage of stomach is very, very important for you, both from clinical aspect as well as theoretical aspect. And in examination also, these questions are most frequently asked if you go through your past question. Okay, so remember 5 arteries: right gastric artery, left gastric artery, right gastroepiploic artery, left gastroepiploic artery, and then short gastric arteries, which are the direct and indirect branches of celiac trunk, which supplies as a whole part of the stomach. Clear? Clear or not?
Yes, ma'am.
Yes, ma'am. Then we'll go for the venous drainage. Okay, so this is descriptive part for you people. Left gastric artery, branch of celiac artery. Right gastric artery, branch of proper hepatic artery. Short gastric artery, which are about 5 to 7 in number, branch of splenic artery. Left gastroepiploic artery, branch of splenic artery, while right gastroepiploic artery is a branch of gastroduodenal artery. Okay, so its course and the area supplying the part of the stomach supplied by respective arteries. This is for you people to read. Then venous drainage. So venous drainage also, all the arteries are accompanied by veins of same name. Left gastric vein, you can see here, left gastric vein, right gastric vein, which drains directly into the portal vein. Short gastric vein, left gastroepiploic, this gastroomental or gastroepiploic vein is same thing. Okay, don't get confused. So short gastric and left gastroepiploic vein drains into the splenic vein, while right gastroepiploic vein drains into the superior mesenteric vein. Okay, the superior mesenteric vein and splenic vein in turn unite to form the portal vein. So all the venous drainage of stomach also directly or indirectly drains into the portal vein. The left gastric and right gastric vein drains directly into the portal vein, while this left gastroepiploic, right gastroepiploic vein and short gastric vein indirectly drains into portal vein, because firstly it drains into the splenic vein, while the right gastroepiploic vein drains into the supramesenteric vein. Now this supramesenteric vein and splenic vein unite to form the portal vein. So remember, supramesenteric vein and splenic vein are the formative tributaries of portal vein. Okay. If someone asks you how portal vein is formed, it is formed by union of splenic vein and supramesenteric vein, while inframesenteric vein also drains into the splenic vein. Okay, so this is about the venous drainage of stomach. This is for you people to study. Left and right gastric vein directly drains into portal vein. Short gastric vein and left gastroepiploic vein drains into splenic vein. Right gastroepiploic vein drains into the supramesenteric vein. This is about the venous drainage of stomach. Then the most important part of stomach, that is lymphatic drainage, because the stomach or gastric carcinoma and all that is very common nowadays. And for that, the metastasis of gastric carcinoma and its root is via the lymphatic drainage, obviously. So it is very important for you in a clinical aspect as well as theoretical aspect. But for this, you have to what you have to keep in mind is all the lymphatic territories actually fair enoughly corresponds with the arterial territories. Okay, so here just to recall about the artery, this part of the stomach which we have studied is supplied by left gastric artery. This part of stomach is supplied by right gastric artery. This part is supplied by right gastroepiploic artery. This part is supplied by left gastroepiploic artery, and funding part of the stomach is supplied by short gastric artery. Okay, so roughly this arterial territories and lymphatic territories corresponds fairly close enough. Now, for the lymphatic territories, we can divide the stomach into four regions. So, depending on the author, if you refer any other books or different book, you can see some of them referred as numbering it from 1, 2, 3, 4, or A, B, C, D, or simply they can describe this part in the part along the lesser curvature, part along the greater curvature towards the fundus, part along the greater curvature towards the pylorus. So it depends. But main thing what you have to keep in mind is these are the main four regions. You can denote them in any way convenient to you. Either you can number it, either you can number it using alphabet A, B, C, D. Okay. But main thing you have to keep in concept is the arterial territories and lymphatic territories are almost close enough. Okay. So here we'll divide the lymphatic territories into four regions, which include area 1. Okay. Area 1, which corresponds along with the lesser curvature but exclude the pyloric part of the stomach. Okay, are people listening? Getting my point? Area 1 corresponds the part of the stomach along the lesser curvature, excluding pyloric part of the stomach. Okay, so the lymphatic drainage from area 1 drains along with the left gastric artery into the left gastric lymph node. From area 1 along the left gastric artery into the left gastric lymph node. So this is area 1 draining into the left gastric lymph node. Then area 2 corresponds the upper part of the greater curvature and fundus of the stomach. Okay, upper part of the greater curvature and fundus of the stomach drains along the splenic vein and short gastric vein. Left gastroepiploic vein, short gastric vein, and drains into the pancreatico-splenic lymph node. So, short gastric node, splenic node, and then pancreatico-splenic nodes are the lymphatic drainage of area number 2. Area number 3 include lower two-thirds of greater curvature, including pylorus also. Okay, lower two-thirds of greater curvature is considered as area number 3, and from this part it drains into the right gastroepiploic along with right gastroepiploic vessels. It drains into the right gastroepiploic lymph node and then pyloric node also. Okay, right gastroepiploic and pyloric lymph node. Finally, area number 4 denotes the remaining part of the pylorus. So area number 4, which denotes the remaining part of the pylorus, drains into all three lymph nodes, towards the pyloric node, towards the hepatic node, and towards the left gastric node. Okay, so area number 4 drains into left gastric node as well as hepatic node as well as pyloric node. But all of these perigastric lymphatic nodules, finally it drains into the celiac node. Here this red color is denoting the celiac node. Okay, so all of these lymph nodes present around the stomach, which is known as perigastric lymph node, finally drains into the celiac node, which is one of the pre-aortic lymph node. Then what happens? This pre-aortic lymph node, celiac node, along with supra and intermesenteric lymph node are also pre-aortic lymph node. Okay, which are the group of pre-aortic lymph node. It drains into the intestinal lymph trunk. Intestinal lymph trunk finally drains into the cisterna chyli, and cisterna chyli begins up, ascend up as the thoracic duct, and finally thoracic duct drains into the venous system, isn't it? At the junction between internal jugular vein and brachiocephalic vein is the drainage of this thoracic duct. So this is about the lymphatic drainage. This thing, if you don't remember, it's okay, but this is the main part you have to remember. Firstly, you should be clear about the lymphatic territory. Once again, I repeat, area number 1 denotes the lesser curvature or the part of the stomach along the lesser curvature excluding pylorus. Area number 2 includes the fundus and upper part of the body. Area number 3, lower 2/3 of greater curvature along with including pylorus. And finally, area number 4 is the remaining part of the pylorus. Okay, once again, I repeat, this lymphatic territories, the notion may be different in different books. Okay, but if you go through or if you understand, all of them are trying to denote the same area. Maybe just the representation or explanation part is different, but they are trying to represent the same area. Remember this 4 areas and its lymphatic drainage. Okay, shall I proceed? Shall I proceed?
Ma'am.
I hope you people are listening. So then finally we'll go for the nerve supply of stomach. The nerve supply of stomach, obviously viscera are supplied by autonomic nervous system. Autonomic nervous system consists of sympathetic and parasympathetic nerve. Okay, so in case of stomach, sympathetic nerve is derived from celiac plexus, while parasympathetic nerve derived from right and left vagus nerve. The right and left vagus nerve gives the parasympathetic supply. Celiac plexus gives the sympathetic supply to stomach. So, about regarding nerve supply of stomach, we have to remember about anterior vagal trunk and posterior vagal trunk. Okay. So initially, within the thorax, we have studied about the right and left vagus nerve. Okay, at the root of the neck and within the thorax, we have studied about right vagus and left vagus. So how the right and left vagus convert into anterior and posterior vagal trunk is simply anterior vagal trunk is formed from the left vagus nerve. In thorax, which was the left vagus nerve, the left vagus nerve enters the abdomen from the anterior surface of esophagus, forming anterior vagal trunk. Are you getting my point? What I'm trying to explain? See, in case of when we study about mediastinum, we have studied about right vagus and left vagus, isn't it? Now, immediately when we study about the stomach, nerve supply of stomach, there is anterior and posterior vagal trunk. But the thing is, like left vagus nerve is the one which runs in front of esophagus when it enters the abdomen, forming the anterior vagal trunk. Now I hope you are clear. Then this anterior vagal trunk supplies the anterior surface of stomach, which has one large branch known as a large hepatic branch, and from this hepatic branch, it gives pyloric branch to supply the pyloric part of the stomach. The next one is the posterior vagal trunk, which is formed from the right vagus. Okay, so along with the esophagus, right vagus nerve enters the abdomen posterior to the esophagus, forming posterior vagal trunk, which supplies the posterior surface of stomach. Okay, one of its large branch is celiac and supramesenteric plexus that forms celiac and supramesenteric plexus and distribute far up to the splenic flexure and pancreas. So it is more clear from this diagram. This is the anterior vagal trunk which supplies the anterior superior surface of stomach, and one of the largest branch of this anterior vagal trunk is hepatic branch. Hepatic branch again give this pyloric branch to supply the pyloric part of the stomach. This dotted line represents the posterior vagal trunk to show this nerve is present on the posterior inferior aspect of the stomach. Okay, and one of the large branch of this posterior vagal trunk is celiac branch, and the celiac branch supplies the sympathetic plexus or sympathetic nerve up to the left colic flexure or the right 2/3 of the transverse colon. This is about the nerve supply of stomach. Applied aspect, peptic or gastric ulcer, we have already mentioned. Hypersthenic type of stomach is having more of the oblique arrangement or more of almost horizontal arrangement. Hyposthenic type is more of vertical arrangement. So in case of hyposthenic type, there is chances that there will be accumulation of gastric juice within the stomach for some time, leading to or making the person prone to gastric ulcer. While in case of hypersthenic type, as stomach is more of horizontally arranged, so the gastric juice can easily flow towards the duodenum, making duodenum more prone to ulcer. Okay. Gastric carcinoma, which is nowadays very becoming very common, gastric carcinoma. Then pyloric obstruction. If the pyloric sphincter is the pyloric obstruction may result or maybe congenital or acquired. Okay, congenital pyloric obstruction, if there is the pyloric sphincter remain closed right from the birth, that is congenital pyloric obstruction. And in some individual, if there is formation of stricture within the pylorus in their adulthood or in that is acquired pyloric obstruction. So this is about the pyloric obstruction. And this picture shows the barium meal. Last time when we talked about the esophagus, we have shown you the barium shallow. Okay, barium shallow is simply a little amount of barium sulfate solution is drained and the X-ray is taken. Contrast X-ray is taken. That is barium shallow, which is done mainly to visualize the esophagus. While if we need to visualize the stomach and small intestine, barium meal is the procedure of barium meal is performed. Okay. And here in this picture, this is the contrast X-ray of stomach and intestine. Here we can see this is the stomach, and this actually is the peristaltic wave traveling through the stomach. Okay, so barium meal may suggest about this any constriction or pyloric obstruction, any other abnormality like gastric carcinoma. So here, this is the stomach, this is duodenum, first part of duodenum, second and third part of duodenum, and this floccular appearance is all the intestine, jejunum and ileum part of the stomach. Okay, so this is just to show you the X-ray of barium meal. About detail, we have to study in our practical classes regarding X-ray of GI system. Okay, so this is all for today. Any confusion?